Maddie Miles here. If you followed along with me this far, I hope you've learned something meaningful from this series, because I sure have. When I started this podcast, I knew what I wanted to learn and how I wanted to portray to my audience. I knew I wanted to get the facts, break it down, put it together, then leave you all with your own thoughts and takeaways from this. But for this episode, I'm going to lay out all my thoughts. Let's end this with my own personal open letter to the government. So, here we go. Dear Governor Bevin, President Trump, senators and representatives, and leaders of this country. My name is Maddie Miles. I'm a 20-year-old college student at the University of Kentucky. I'm a human health science major with intentions of becoming a physician assistant. I'm writing to tell you how I feel about the future of healthcare for the state of Kentucky and this country as a whole. I'm at the beginning of my professional career. I have absolutely zero experience working in the government or with designing laws for healthcare. I am by no means a health policy expert. In fact, maybe in your eyes, I don't understand your job at all. But I took on a project this year to at least try to understand. This project focused completely on healthcare legislation in Kentucky and broadcasting the positive and negatives to these new laws. And like the title of my podcast says, I just wanted the people of Kentucky to know what the health was going on. And so, I think you all have done some really great things in healthcare. And then again, there are some things you all have done that maybe I don't agree with as much. But that's okay because we're all human and we don't all think or operate the same. But if you could clear your mind and imagine the way I think for just a few minutes, I would really appreciate it. Let me paint a picture in your mind of my perfect world. In my perfect world, Kentucky is the leading state in healthcare. We are a model for other states to follow. People don't joke about us being uneducated or being tobacco lovers or even being fat. People don't ask us if we sleep with our cousins or if we wear shoes on a regular basis. People will think, wow, Kentucky. Louisville is the safest city. Heroin is not a problem there at all. Smoking in Kentucky? No way. And I heard Eastern Kentucky is the best place to live. I heard they have the best healthcare in the state. That state has came so far since X amount of years ago. But how? How will Kentucky strive towards these new perceptions that I want so badly for this state? I said it before. We have to begin tackling the greatest healthcare issues in this state: cancer, lung and heart disease, and obesity. First of all, after the tobacco buyout 10 years ago, why do we care about tobacco sales in Kentucky now? That's not even one of our major cash crops now. We literally complain as a state constantly about how there's not enough money in our budget to spend it on everything. So here's an idea. Why don't we tax tobacco insanely high like every other state around us does? If people can't afford to smoke, they literally won't be able to. And guess what? Maybe they will decide to quit and fall back to the newly insured tobacco cessation plans. By the way, thank you for that, Governor Bevin. Smoking causes cancer and lung and heart disease. We need to stop it and make people want to quit. If we can't make them want to quit, then we could at least make them financially have to. As for lung and heart disease, lung disease is mostly so common in Kentucky due to the high percentage of people that abuse tobacco. Easy, raise the tax sky high. But then we can also look at another huge cause of heart disease: obesity. Kentucky is literally obese. And it's not completely our fault. We live in a culture that uses food for everything, and I mean everything. Today's your birthday? Cake and ice cream. You got a new neighbor? Take them a pie. Football game? Hot wings. Funeral? Bring comfort food. This country thrives off of finding reasons to eat, even when someone's passed away. And compared to other countries, that's really weird. I mean, it was the other day when I turned on my television and there was a TV show glorifying obesity. There is nothing happy or glamorous about being obese. It is a health condition that must be taken seriously. We need to have a state of Kentucky boot camp to get things back in order. How do we do this? First of all, we have to start this prevention in early childhood years. Teaching kids the food groups and the importance of eating balanced meals is not a joke. It should be required everywhere. Secondly, why can't we do something really simple like remove all soda vending machines from Kentucky schools? Removing soda is so easy to do. It requires little to no money from the state, and it would limit an easy access sugar source to students. And this third one, I cannot stress enough. All schools in this state should have competitive sports and or intramurals. Sports are a huge incentive to be physically active and to stay at a healthy body weight. It has also been shown that students who participate in sports are less likely to fall in with teenage pregnancy and drug use. Bottom line is that we must always appropriately fund our high schools. If we don't have the money, that's okay because we're going to fund it with a new tobacco tax that I mentioned. This state has lots of good things going for it. Governor Bevin, I have credited you a lot throughout this series because I have been a huge fan of some of these laws brought in under you. But for other things, I wasn't as big of a fan. But that's okay. My ideas I mentioned aren't drastic. Actually, you've probably heard them before. They don't hold the answers to this world, but they are simple and could bring positive change to our state. And maybe we could serve as a model for the national level too. These problems aren't just prevalent in Kentucky, they're prevalent throughout the entire United States. So, along with all the national problems we have, maybe we could start by being the voice of change for the rest of the country. But one last thing I want to leave you all with. While you all are reorganizing healthcare and reappealing and recreating, please remember this world is full of human beings just like you and me. No matter the race, gender, religion, or ethnicity, we are equal. We are all human. I know your job isn't easy, but at the end of the day, do not go in with the mindset just to fulfill a political agenda. Please have the courage to do what is right and to listen to your heart. Because at the end of the day, we all just want to feel happy and safe in this big, huge world. And with your guidance, maybe you all can lead this country away from the dark place we have been at for some time. Please be the light in this world and make this country the new role model for healthcare. And I hope maybe Kentucky Help can lead the way someday. Sincerely, Madeline Jewel Miles. Thank you for listening.